And good morning. Today we're going to talk about the role of the biomedical engineer from a social, economic, environmental, and ethical point of view. We are Laura Camila Puerta and me, Angie Nicole Iriart. Okay, to begin with this exposition, it's important to know the importance of the role of the biomedical engineer in the society, not only from a technological point of view, but also from the ethical point of view. Mm, the bioethics in the field of the biomedicine has a very important role because we are the ones who design and control the technology that is stays on the patient, so we have to give priority to the common benefit of the population, protecting and caring for their lives. So we have, according to the Leonardo da Vinci Graduate School of Engineering, the rights and duties of patients as individuals are influenced by bioethics as well as the code of ethics of bioengineers. Their importance is replicated in different fields such as health, research, and community life. This part confirms that bioethics in biomedical engineering should be applied to all fields of the action. So, uh, we are going to continue with the application cases. The first example that we will show you is related to the COVID-19 pandemic, with the high occupancy of uh, ICU beds around the world. Medical resources were no longer sufficient. Mechanical ventilators were in short supply, and doctors had to take decisions. So, the Italian Society of Anesthesiology introduced the identification of an age limit for accessing intensive care in case of necessary. So, this is a very ethical issue with respect to the choice of who will live and who will not. Then many people who were not trained start to develop artificial ventilators with materials without enough uh, scientific evidence. Even though these people want to help, they were doing the opposite. These devices were allowed to be created through the use of 3D printings and test on sick patients. This is quite an ethical issue because patients were being put at greater risk, ventilators were falling, and people were dying. So, also, from an environmental point of view, affect the did affect the development of these devices because they were being made of plastic that will later be discarded to the failed test. And the other case that we are going to talk about it is in the rehabilitation engineering area because in this area the biomedical engineering has to create supporting devices to help people with disabilities to have a better quality of lives. To give a better explanation, we have the patient case that has a left spastic hemiparesis, mm, meaning that she can move her left hand and doesn't control her strength. So, a biomedical engineer must develop a device that allows her to do this action, and but to do this, he must think in four factors, which are social, economic, environmental, and ethical. So, to the social impact, a solution must be thought of that will have a positive impact on the patient and help her to live fully and independently. Mm, for an economic impact, the engineer must select materials that are low cost but will generate the greatest benefit for the patient. The socioeconomic level of the patient must be considered, so that people who don't have a lot of money can have the solution. Mm, in the environmental impact, it's similar. The selection of materials affects the environmental, so the engineer must think about the generating less waste and taking care of the environment. Finally, from the ethical point of view, the principles of respect for human dignity should be used because we are not working with people with different capabilities than the common person. So, solidarity with people who have less and also need help from the engineer and privacy.
As mentioned previously, in research there are numerous instances where maintaining an ethical stance is imperative, be it concerning clinical trials, the accuracy of results, and various other factors. Furthermore, in a clinical setting, situations frequently arise and need engineers to take decisions and actions. Take for instance the field of clinical engineering, where our role is to ensure the safe and effective operation of medical equipment and systems. In these scenarios, ethical considerations are paramount. We have here a definition that says clinical engineering is a specialist strand of engineering focused on excellence in the application of technology in the clinical environment. As a discipline, it is concerned with the application of engineering tools and theory to all aspects of the diagnosis, care, and cure of disease and life support in general, all of which are embracing the term delivery of healthcare. In this field, the entire technological process is covered, from the acquisition, installation, maintenance, and calibration to the final disposal of the equipment, all of which require a strong ethical stance. Next, I will mention a possible situation in which a biomedical engineer may become involved, and this situation was proposed by Walter Brisbois, the author of the book Biomed's Handbook.
Okay, this case is an infant incubator that causes skinburn. A nurse pulled a neonate out of an incubator due to excessive crying and realized the neonate received skin burns. After the incident, I did a review of this incubator by running full performance tests. I found the primary heating circuit failed and allowed the heating element to stay unfolding. I also found the secondary over temperature safety circuit was bypassed, which allowed the internal temperature to rise high enough to cause the skin burns. In this situation, the biomedical engineer who maintained this medical device had a questionable ethics because the safety was bypass or negligence, and his prior in the preventive maintenance results state he tested and passed over the temperature safety circuit numerous times. An ethical engineer will never bypass a safety circuit and falsify preventive maintenance results. It can be seen in this case that a good job has not been done in the maintenance and calibration of the equipment. We find that in Colombia, several cases have been reported where babies have died or suffered burns to the malfunctioning of the incubator. The impacts of our actions in a social way can directly influence the health of the patients and his family, delayed improvements in the state of health. We want to ensure the medical device works every time and without failure. In economic side, the maintenance is done in order to extend the life of the equipment, which means less cost in repair and spare parts. And another point may be that it will avoid lawsuits to the hospital due to equipment failures. This is really important to have in mind. On the environmental side, it will mean that this equipment will last longer, therefore, it will not generate a large amount of electronic waste. In addition, from the biomedical management, the final disposal of this equipment is carried out, where the aim is to minimize the environmental impact. An ethical biomed engineer will ask other biomeds for assistance, training, if they're not feeling confident while are performing this maintenance. Uh, an unethical biomedical engineer either bypasses some or all preventive maintenance, testing, and then falsify test documentation, or knowledge performs improper testing. Okay, after hearing these cases, we can draw some conclusions. The first one is that the role of the biomedical engineer in any work context requires a human and ethical part where he empathizes with patients and the population in general, making decisions that protect their life regardless of the level of technology. The second is that the most suitable profile to work within the area of medical equipment maintenance must be based on professional, ethical behavior and conscience, prevailing the well-being of the end user of medical equipment who places all their hopes in said equipment to obtain a cure or bring about better way his illness. And the third one is as engineers, we have a major responsibility in collaborating in the fields of engineering and medicine. Our fundamental purpose is to improve people's quality of life and ensure their safety in the field of healthcare. For this reason, it is essential that all the processes in which we participate are carried out with a high degree of honesty, truthfulness, and ethics. And now, finally, we have our references. Thank you for your attention.